And we need to have a local face, a local voice speaking for our patients, or our voices just are not going to be heard.
Welcome to EyeCan, a podcast about ophthalmology through a uniquely Canadian lens with Dr. Mona Dagher and myself, Dr. Hadi Saheb.
Bienvenue à EyeCan, un balado sur l'ophtalmologie sous un angle typiquement canadien, avec le Dr. Hadi Saheb et moi-même, Dr. Mona Dagher.
Season 4 of the EyeCan podcast is brought to you by Bayer Ophthalmology. We thank them for their support. Nous aimerions remercier Bayer Ophthalmology pour leur support de la 4e saison du balado EyeCan.
We will share our experiences as ophthalmologists today and tackle some of the challenges we face as healthcare providers. Hey there, eye care enthusiasts. It's Mona and
Hadi, back at it again with EyeCan.
You know it, Hadi. Today's episode is going to be a real eye-opener. Pun intended.
Mona, always with the puns. I promise, folks, today's discussion will be just as sharp as Mona's great wit.
Hey, we're here to keep it both informative and entertaining, right?
Absolutely. So whether you're a seasoned ophthalmologist or just as fascinated by eyes as we are, you're in for a treat. Hi, everyone. Today's episode of EyeCan is a special episode as we welcome back to the show Phil Hooper, President of the Canadian Ophthalmological Society. Dr. Hooper will present some of the advocacy work the COS has currently been working on, future planning, and new projects underway. A bit about Phil. Phil Hooper trained in internal medicine and ophthalmology at Western University in London, Ontario. Following this, he did fellowships in both Retina and Uveitis at the University of Southern California and Washington University. He was chair and chief of ophthalmology at Western from 1996 to 2008 and co-chairs the Ontario Vision Care Task Force.
In June 2022, Dr. Hooper became the 70th president of the COS, serving until June 2024. He has been involved in many COS projects. He was editor-in-chief of the Canadian Journal of Ophthalmology from 2008 to 2018 and chaired the Council on Advocacy from 2019 to 2021. Phil, welcome back to EyeCan.
Thanks very much for having me.
So Phil, something I wanted to start with today was to hear a little bit more from you about how you are engaging with policymakers and other stakeholders to advocate for the importance of vision health and what strategies you are taking to educate the government about vision health.
It's been a pretty exciting time over the last couple of years because at the federal level, there has been a bill introduced by Judy Scrow to develop a national vision strategy. And that bill has passed unanimously through the House, and it's now sitting in the Senate and expected hopefully to pass before April. What this bill will do is to focus the federal government on the totality of vision. Right now, they look at vision in little snippets, this aspect of drugs, this aspect of devices, but it'll bring it all together and hopefully allow us to develop a strategy that will enhance Canadian access to vision care research and also develop some policy at the federal level that'll help unify the delivery of eye care across the country. The other thing that we did recently that I'm kind of excited about is we had opportunity to create a submission to the Drug Shortages Task Force that the federal government convened. As everybody who practices in Canada knows, drug shortages have become a real bugaboo of trying to practice eye care. You never know what drug is going to be in and out of stock and how that will manifest in our ability to provide care. We created as part of this an essential medications list, which now will inform the federal government of drugs that are very important when they go out of supply and allow us to more rapidly develop alternative mechanisms of getting there. You'll hear more about this or have opportunity to do so at the COS Forum in January.
So on the topic of advocacy, for for our colleagues and COS members across the country, what are some of the tools available to them to assist them in any of their own advocacy activities, and how can they hear more from the COS about COS's advocacy efforts?
We're trying to keep everybody abreast of all of the things going on in several ways. The COS Forum, which is a major way that we're doing this, and the topics this year will involve talking more about advocacy. We're also going to talk about medications and shortages, artificial intelligence, sustainability. The other thing that we do on a more regular basis is the sight lines, where we have an update on a monthly basis of what's going on in advocacy. Within advocacy, we've created a number of resources that are now available on the website to members that will assist them if they need to do advocacy on their own, and hopefully encourage them to have more of an interest in this manner.
So, Phil, you're doing so much work, you and the COS are doing so much work nationally from an advocacy standpoint. And I'm just wondering if, compared to the work that the COS is doing nationally, how important do you feel it is to have these like grassroots advocacy efforts at, like, at a regional hospital or province wide? How important are those more local advocacy efforts compared to what's happening nationally?
I think they're even more important in some respects than the national effort. The delivery of healthcare is done on a very local level, and certainly the decisions regarding the delivery of care, more of them are made directly at the provincial level than they are at the federal level. The federal government's involved in devices and drugs and regulation and providing bulk funding, but the decision as to how drugs are made available is done at a provincial level. How operating time is allocated, the emphasis put on eye care amongst other services, orthopedics and so on, that are competing for OR time, that's all done at a very local level. And we need to have a local face, a local voice speaking for our patients, or our voices just are not going to be heard.
That's such a great point, because, I think, the most sophisticated advocacy team in Canadian ophthalmology is probably the COS one. But I think what you're saying is that beyond the COS advocacy efforts, all of us, as much as possible, should be having our own advocacy initiatives, locally and specifically provincially. So I think that's a great reminder to keep up the work on a local level. So thanks for that.
And we're to support people in that respect. We have a lot of resources, and I would encourage members to reach out to the COS if they have questions or problems.
Thanks, Phil, for that. On a different topic, also COS members count a lot on COS for their learning opportunities. Can you tell us in what ways COS is contributing to the professional development of Canadian ophthalmologists? And what are the changes in medical education, and how is the society adapting to all this?
Change means nothing staying the same. And I think that has been something that I've observed over my career in ophthalmology and my career in medicine. It never stays still. In years past, continuing medical education, as it was then called, revolved around attending lectures, conferences, scanning journals to passively become exposed to new concepts and knowledge. In recent years, as we all know, we're more and more being asked by levels right from our hospitals to provincial bodies to the Royal College to demonstrate that we've actually learned something, that this is changing our practice, and that it's changed our thought processes. And we now have, as a result of these changes, changed how our annual conference provides material. We've done much more programming that deals with communication, wellness, and other non-traditional skills, as well as increased our emphasis on skills transfer and learning that we can actually demonstrate that we've changed. We've supported and developed non-conventional learning opportunities. And we look forward, I think, in the next year to learning more about what the Royal College plans to do to change their maintenance of certification process. We want to continue to be ahead of the ball, so to speak, and guide our members as these changes are rolled out over the next year or two. In addition to this aspect of the practicing ophthalmologist, we've also started to emphasize resident involvement. One of the themes in education has been the continuum of learning beyond residency, that it's more seamless, that you learn in a programmatic fashion during residency and move out in practice and continue skills development in the same fashion. And so we're working with residents to get them involved in programming that's relevant to them. And hopefully, as this moves forward, acting to provide information about practice management and other skills that aren't traditionally taught in a residency program, to develop a sense of ownership, belonging, and hopefully have them become active members of the COS when they're practicing. We'd also like to engage non-members, and we recognize that only about 35% of ophthalmologists aren't engaged with the COS directly. We're doing surveys and focus groups to try to understand how we can engage with individuals in a more meaningful way and hopefully bring meaning to their interactions with us also.
It's true that COS has a lot of wonderful opportunities, and I think that encouraging ophthalmologists to become members, they'll know the value and they'll see how much is offered.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca. We will try to incorporate them into future episodes.
I'm Ravi Dukran, and I listen to the EyeCan podcast.
In addition to an overhaul of the site of the PRC, the Practice Resource Center is launching a learning hub, and the cornea modules have already been released. Can you tell us what else is coming up?
I would encourage, first of all, anybody who's listening that hasn't done the corneal modules or at least looked at what's there, I'd encourage people to go and look at that. They're fascinating, they're engaging, they really bring what I find a very complex area, and they bring it down so that even a retina person can understand cornea, which is something that is not that easy to do. The modules, I think, form a really great basis, and we're engaging with other specialties and disciplines in ophthalmology. They form a great platform and a basis to have other topics covered. So we're hoping to expand this over the next several months.
Right. Yeah, we are working on more modules, that's for sure. I'd like to see different modules come up, like glaucoma and retina as well, so that the cornea specialist in me can read retina and understand it better.
Coming to a computer near you in the near future.
Awesome. Thank you.
So moving on to another part of the COS, which is patient engagement. I'm wondering if you could tell us more about how the COS is working to ensure that patients are active participants in their eye care journey, and if there are any initiatives currently in place to enhance patient education and empowerment.
I think there the thing I would point people to is to see the Possibilities website. If you haven't seen it lately, it's worth going back. The site has dramatically expanded since its inception, probably, I guess, 5 years ago now. And it contains a wealth of information ranging from interactive quizzes that talk about diverse areas. Who are the people involved in eye care, differentiating ophthalmologists from optometrists, to talking about common eye diseases and uncommon eye diseases, what people should think about in terms of eye protection, eye health, and demystifying some dogma that is perhaps not as correct as it should be in the popular opinion. In addition to all of that, there are informational materials that people can look to that tell them a little bit about common procedures that are done, what are the things to look for, and it's always evolving so that it's always interesting and provides feedback. The other area, and probably the most popular area that has been developed in the last 2 years, is to ask the expert, where common eye problems are discussed by experts in the area, and questions from patients are actively added on an ongoing basis to try to answer things that people are interested in.
What are your thoughts about the role of media? Sometimes media will cover topics related to vision care, and what's your opinion about the importance of media regarding patient engagement?
I think it's tremendously important, and we've engaged with different media, print, radio, television, and social media to try to bring our message into individuals in all different walks. Each month we create a press release that highlights one or more aspects of eye care, eye health, ophthalmology, what do we do? And it is placed before media outlets, and then that usually has led to uptick right across the country, an opportunity for our members to tell the story and answer questions about it. I think one of the things that has shown how much interest has actually been generated was an event that occurred in the fall, where it was sponsored by the CBC, and basically they had CBC outlets from coast to coast had 15 minutes with an ophthalmologist to ask questions, get them answered, and then that became part of a live broadcast. And for those of us who participated, it was sort of like 20 questions sped up, that every 15 minutes you had a new interviewer and a new set of questions, and away you went. But there was really big uptake, and I think it allowed us to get the message across in a very effective manner. Through all of this, we've had the ability to engage ophthalmologists coast to coast as spokespeople. We provide some media training and some help, briefing materials for them, but we're always looking for more ophthalmologists to get involved. Anybody who's interested in participating should feel free to reach out to Kim Teitler, who's the communications director at the COS, and she can be reached at kim@cossco.ca.
That's great. Phil, I see the COS is really being very involved in the arena, and we're really working hard to represent our members for the learning opportunities for our patients and also for the advocacy of our profession. Can you tell us about other new initiatives that COS is working on at present?
Recent events have produced new challenges and opportunities for us in a few areas. For example, the physician shortages we're all very aware of have prompted governments to do a few things, one of which is to look at increasing the physician pool by means of immigration. The federal government's worked with the Royal College and the Medical Council of Canada to streamline the evaluation process for foreign medical graduates, and they've commissioned a study to look at the needs in this area. We hope to be able to bring the perspective of vision and ophthalmology to this and demonstrate the need that exists across the country, and hopefully have our voices heard. This is coupled as well at the provincial level with changes in licensing regulation, and several provinces have announced initiative to increase medical school enrollment and create new medical schools. The one thing that really hasn't been moved forward on, that we're advocating for and hope to see some movement, is the portability of licensing between provinces to allow people to do locums, to move back and forth, particularly in border areas between provinces, to more seamlessly be able to provide care. The increase in medical school enrollment leads or will lead in about 4 years to a new cohort of individuals newly graduated who will be going on to do residency training. Working with the CUPO, we've convened a working group to look at the training potential for additional ophthalmology trainees across the country, and we're going to then develop materials that can be used at the local level, because at the present time, the decisions around residency numbers in individual medical schools are made at the local level, and as well to hopefully be used at the provincial level to do some lobbying around the need for additional training positions. The other thing that we're looking at very closely is the pending development of treatment for dry macular degeneration. Those of us who were involved in ophthalmology at the time that treatment for wet macular degeneration came about remember a massive influx of undifferentiated patients that were referred, and it just overwhelmed our ability to cope for a considerable period of time. And we hope as an organization, again, working with a group of individuals in this area, to develop referral criteria or referral guidelines that will hopefully make the intake funnel manageable and avoid a similar overwhelming of the process.
So, Phil, not too long ago, our ophthalmology residency graduates were, sometimes worried about being able to find a job. And here we are making it easier and more accessible for foreign medical graduates to get ophthalmology jobs in the country. Clearly, something is changing in the job market. Can you tell us a little bit more about why and how things are changing and how we can reassure our ophthalmology graduates that their job prospects are still very good?
I think that's a really valid concern. And one of the things that we're looking at doing and will be doing in the next few months is to try to survey the people that are about 2 years out of training to understand what have they done following their graduation, where are they now situated, have they met their goals in terms of beginning a career, have they been able to do that in Canada, what is their access to operating room resources, those kinds of things, because we really don't have a clear handle on those. As you say, that has been a concern and a real problem. I think one of the things that has changed in the recent past has been the development in many provinces of increased partnerships between hospitals and so-called private medicine to provide out-of-hospital ability to do eye surgery, and in many cases have this linked with what goes on in the hospital system. To some extent, that has the potential to provide the best of both worlds. But again, we want to understand what the real experience has been and to hopefully make it a better experience for recent graduates so that they have more access as they move into practice. So I think that to summarize what I've been trying to say, I think we need to understand better what the real experience is now with the changes in practice and the increased number of independent facilities that are out there. We need to understand what the federal government proposes to do and how this may potentially help. And we also need to make sure that we have an increased ability to train Canadian graduates from all walks of life to be able to be ophthalmologists.
In the glaucoma world, at least, it's often labeled as the glaucoma tsunami that's coming on us. With the aging population, glaucoma becoming more interventional. There's a real fear that very soon the current workforce will not be able to appropriately care for glaucoma patients. And so, a few years ago, it was difficult for a glaucoma subspecialist to find a job. But right now, the landscape is very different for glaucoma subspecialists looking for a job. There are multiple opportunities, and across the country, academic and non-academic centers are looking to recruit glaucoma specialists to meet the needs of the patients. And so, I think we're, as a group, as a glaucoma group, we're certainly, supportive and happy that the COS is working on making it easier for qualified individuals to come and take care of Canadian patients, because we do feel like with the demographic changes and the changes in the way ophthalmology is practiced, we do need as much help as we can get to properly care for patients. So thank you. So Phil, as you know from the previous podcast, we like to ask questions about what else is going on in your life. And it's kind of a crazy question to ask you because the COS and all of us are keeping you so busy. So I don't know if you're able to fit in anything else. But given that this is your second podcast, I'm wondering if, in the last year or two, there's something you're doing more of that you're willing to share with us.
Well, I think my sort of life-changing thing is, along with being the president of the COS in the last couple of years, is that I've become a grandparent twice. And so that's a new life experience for those who have not yet experienced it. It's like parenting, but better. And people have talked about that. I'm sure you've all heard it. It is wonderful. I think the nice thing is that it's allowed me to interact and recognize the joy of childhood, the seeing things, experiencing them for the first time, and that really brings you back to reality. It's been a lot of fun. And so, yes, that's occupied a lot of my so-called extracurricular time over the last couple of years. I'm busy working. I like to make things and do things in my spare time, and I'm trying to bring back to life two old metal pedal cars from the 50s, one for each grandson for Christmas. And I've decided that paint is out to get me because it's thwarting me at every turn, but I think I'm going to make the deadline.
Wonderful. That's awesome. You've always been interested in older cars?
Much to my father's chagrin, yes, from a very early age.
A fun habit. That's cool.
Well, enjoy grandparenthood. I'm on my first wave of parenthood, so I'm in the all-encompassing 24/7 phase of parenthood, and it's full of magic. And I totally appreciate from my parents and in-laws that doing the second time around where you can be on a shift and check out when the time is right is the kind of all the magic without the fatigue. So kudos to you, and I'm glad you're enjoying that.
It is great.
Thank you, Phil, for being with us tonight. Thanks for sharing all your insight, and thanks especially for the wonderful work you do for Canadian Ophthalmology.
Thank you very much. And I, in turn, would like to thank all of the ophthalmologists across Canada who participate in the COS. It's a kind of trite to say we couldn't do it without you, but we really couldn't do it without you. And everybody is stepping up, and we're moving forward because of the work of many.
Thank you.
Agree. Thank you.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we will try to incorporate them into future episodes. Season 4 of the EyeCan podcast is brought to you by Bayer Ophthalmology. We thank them for their support.
Nous aimerions remercier Bayer Ophthalmology pour leur support de la 4e saison du balado EyeCan. Thank you from the Canadian Ophthalmological Society.
EyeCan is written and directed by Kim Teitler and produced by John Allaire from Allaire Strategic Works.
EyeCan is available on Apple, Spotify, and Google platforms, and of course, through the COS Practice Resource Center.
Some episodes this season will include relevant links and show notes, so be sure to check episode descriptions to learn more.
Thank you for joining us this week. We look forward to bringing you more episodes.